welcome to the WCSO News Video Podcast. I'm Deputy Brian van Kleef, and I'll be your host for this episode number 2, where we talk about all things Washington County Sheriff's Office. And today we're going to talk about the Washington County Jail. It's something unique to the Sheriff's Office. And we have 2 very special guests, Lieutenant Caprice Massey and Deputy Brandon Toney, both from the Jail Division. So let's start with, let's get right to it, talk with Lieutenant Caprice Massey. And we want to talk about kind of what everyone is kind of focused on right now, and that's obviously COVID-19 and how the jail is dealing with that. Thanks for being with us, Lieutenant Massey.
Absolutely, I'm excited.
So tell me a little bit about what, obviously there's probably more that you can even remember off the top of your head. The list is so long of things that the jail has been doing to fight this pandemic. Can you give me a little brief overview of that?
Gosh, I will. We were very fortunate. We started so early. So around February 6th, we started asking every adult that was coming into custody whether or not they had traveled out of the country, whether or not they had experienced any sort of flu-like symptoms or had temperatures or were symptomatic of anything at all. It was initially catered towards the flu and just expanded from there. We have since then been on a continuous operational plan of adding more and more resources, I guess would be the best way to put it. We are taking the temperature of every officer and adult in custody or adult they're bringing into custody in the Sally Port before they even come in. If the temperature is too high, they're taking that person off to the hospital. All of our staff are having their temperature taken before they enter. In fact, now all of our staff are wearing masks inside the facility. Go ahead.
Okay, speaking of masks, has it been an issue at all getting, the protective equipment for staff and even people in custody to have available? We
have been ordering consistently since all of this started, but we have also had so many volunteers that have made masks and donated them. So we are able to issue all of our adults in custody masks for any time that they're out of their cell. And we have enough that we can rotate those through every single day and get them laundered. So we actually have plenty of PPE on site.
That's great news.
Yeah.
As part of the administration team of the jail, how have you had to sort of change the daily operations and the day-to-day? I mean, you can't operate the jail. I always kind of compare the jail to a cruise ship. And we all know, like, if there's a virus on a cruise ship because of the contained space, it can spread like wildfire. And I think
absolutely.
A lot of people have that same concern in a jail type setting. So how have you had to kind of alter operations in that way?
We did some really critical things pretty early. We closed our 1 dorm housing unit. So we no longer have adults in custody living in one big room, sharing, 8 of them is what that dorm held. So now everyone that comes into custody is segregated in their own cell. Additionally, we're only allowing 25 adults in custody out of their cells at one time. And we have constant cleaning measures in between people that are coming out. We're also feeding everyone. All of their meals are happening in their cell, so that they are able to observe those social distancing requirements and not congregate.
All right. One thing I want to mention is you mentioned the term adult in custody, and that may be a term that's unfamiliar for a lot of people. I mean, we're used to the term inmate and using that term quite a bit. Can you tell me a little bit about where adult in custody kind of came from as a phrase that we use now?
Yeah, actually, the Oregon legislature has removed the term inmate from all of the legislature and replaced it with adult in custody. And so we've adopted it as well, because it's critical that people know that just because someone is in custody, oftentimes a determination hasn't been made on guilt. And so these are just adults in custody at this time. They're not necessarily convicted. And it takes away some of that negative connotation, I think, that inmate held.
Sure. All right. Well, thank you very much for those answers. We'll get back to you in just a few minutes. We're going to bring in another member of the Jail Division, Deputy Brandon Toney, who's kind of on those front lines of dealing with inmates in those housing units day in and day out. So let's check in with him. And thanks for being with us, Deputy Toney.
Hey, thanks for having me.
So you're in there in the housing units, we also called pods. Tell me a little bit about how life has changed from your perspective, and then also maybe a little bit from the adults in custody who are in those pods.
Yeah, in terms of the change, a major change that we're seeing is just the sheer numbers of people that are in every pod that we're managing. Previously, you would have up to 60 people in any particular pod at any given day. But because those numbers have been pretty drastically reduced, you're maxed out at around 50. And then in terms of your recreation time, the time spent outside of their cells in the day room or those public spaces in those pods, you're limited to max of 25 people. So in terms of management, in a lot of ways, it actually is a little bit easier to some degree because there's a smaller number of people out at a given moment.
How is that? Obviously, we talk a lot about people having to, in the stay-home orders that are in place, people are getting a little stir-crazy just in their own houses. Yeah. I can imagine it can be difficult for adults in custody who are, limited and they're already limited by being in jail, but now they're limited even more because we have to enforce, some social distancing requirements. How are they responding and reacting to the new rules?
I think as far as the new rules and how they're adapting, I think they've actually done a pretty good job at that. Most people are taking it in stride. We have TVs in every pod that there is, and so people are seeing the news and they're seeing what's going on. I think primarily, though, that what we're seeing in terms of attitudes that's changed a bit is just the uncertainty, specifically for those folks that have been in custody for any length of time. If they have if they're awaiting trial and it may have been months up until now, they've gone through this entire pandemic inside of the in custody while they're here, and they don't know what's really going on outside. So we get questions often, saying, "Hey, deputy, what? Is everything shut down? Do you see people out at all? They have questions about what life is like outside of the walls here." But I think that's a lot of the concern and the questions because, if you have the news on all day, and you don't have any other perspective as a person who goes to the store or does your day-to-day business, you don't really know and have a frame of reference to look back on. So I think there's a lot of concerns and people wondering about family and such. That's probably the biggest adjustment is just the limited communication because the fact that there are less people out at a time, that does subsequently mean there's a little bit less out time as well. So they may not be in contact with family and friends as much or as frequently as they were in the past.
Yeah, and life has changed outside the jail for sure. How are adults in custody staying in touch with friends and family? With social visiting, I know has been basically closed off while this pandemic is in place. How is visiting happening, not only with family and friends, but with attorneys and, obviously they have phone calls and video visiting, is that right?
That's correct. Yeah, that's one of the things that's actually that I've noticed that's been on an uptick is a lot of the video visiting that's been taking place. Folks that are in custody are able to schedule visits and family member as well, so they can have video visits similar to what we're doing now on a Zoom call type of scenario. So they're able to get a little bit of face-to-face time with their friends and family, which is huge and very helpful. Also, there's going to be phone time as well, and they do have tablets. There's a limited number of them, but there are some tablets in all the housing units or the pods that allow text messaging back and forth and such. So there are ways definitely that people are able to communicate with their family and friends. Also, in addition, there's some new things that we've been doing pretty recently here, which is being able to transmit messages back and forth. So there are some staff members that are receiving phone calls, and those folks will call the pods directly and speak to one of the deputies working in those pods, and say, "Hey, listen, I need you to let so-and-so know that they need to call their attorney as soon as possible to discuss the details of their case." So there is a bit of there's a lot of accommodations so that they're able to get in touch with their legal team, their attorneys, as well as family and friends. So yeah, there's just definitely been some changes there for sure.
Sure. All right, Deputy Brandon Toney, thank you. I want to transition us now to a different jail-related topic, and that's mental health. A large percentage of the people in our jail are part of the mental health community and deal with those mental health resources. So take just a minute and watch a quick video about mental health in our jail.
On any given day, nearly 1/3 of the people brought to the Washington County Jail have some kind of identified mental health condition.
Well, we see people with all kinds of issues, whether it be a temporary mental health crisis that they're in, that they're facing just at that specific time. Then we have mental health staff on hand for them right then and there. But then we also have people with long-term mental health issues, and whether it be that they're off their medication or something else just triggered this incident, it's just something that we have to deal with on a daily basis.
Even before they walk in the door, arrestees are screened for mental health conditions, including thoughts of self-harm and critical medications.
When patients come into our facility, we screen all of them with an extensive mental health history and their current mental health issues they may be dealing with. That'll include any previous care that they may have received in the past in different communities, what type of medications they may be taking or require while they're here, or if they're even receiving treatment at all.
Inmates with mental health concerns are often housed in what's called the Special Needs Pod.
People with special needs oftentimes present a little bit of a different challenge, because not only do we have to keep them safe from others, but also from themselves. So what we actually did in that case is we took a lot of people with special needs, whether it be elderly folks that wouldn't really do well in a general population around some of the other people that we deal with, or people with significant mental issues of any age group, and we've put them into a specific housing unit. The deputies in that housing unit are trained in mental health crises and conditions, and then we also work hand in hand with our partners in not only the criminal justice system, but also with the mental health services, so we can get them stabilized on their medication if need be, and get them through the criminal process so that we can actually get them released and then hopefully get them leaving the jail in a better situation than when they came in the first place.
Some of the special features of SNP include giving inmates a creative outlet with a chalkboard, calming therapeutic colors painted on the walls, and even live plants that the inmates help care for.
I think that it's successful because of the staff that we have in there. And from my perspective on that, we see the same people on a regular basis, and one way or another we've almost built some kind of working relationship with those people. I can't tell you how many times I've been in the intake area and we've had somebody come in and they recognize us by being a special needs inmate, and it just takes one of us on the actual special needs team to walk into the area, and that immediately will calm them down just from that rapport that we've had in the past.
Caring for our special needs population doesn't end when they're released from custody. Washington County's mental health team works with the Sheriff's Office and other community partners to make sure these inmates are set up for success in the community.
So basically what I do, I meet that particular individual, I introduce myself, try to build some type of good rapport with that individual, and then ask them, would you like some help getting back involved in the mental health community? If you've been involved in the past in mental health treatment, is that something that you're open to doing again? If so, we've got a number of different agencies you can get involved with.
It is a support system in that we take a lot of those inmates going through that same crisis, and it's easy for them to relate to somebody else that may be handling or going through that same situation. So by putting them into the same housing unit, they can a lot of times relate to one another, rather than being in a situation where they have a lot of people, surrounded by 60 other inmates that they feel they cannot relate to. So not only are we connecting them with staff members and mental health resources, but they're also being connected with other inmates that may be in the same situation they are and can relate to them.
We found that dedicating a lot of our resources here towards helping people with mental health is crucial to the safety of within the jail and helping our community, not just while they're in here, but being successful when they get released from jail.
There's a lot of people come into the community and they really don't have much in terms of their needs. I mean, they need housing, they need mental health treatment, they need medical care. So that's sort of my job, to try to help bridge that gap, if you will.
I've been with the Sheriff's Office for 11 years now, and I've been on the SNP team for a number of those years, and in my experiences with it, it's been positive. I've heard that from other staff members, I've heard that from mental health professionals, I've heard that from inmates that come through here, as well as family members of inmates that have come through here that have told me that it's been a positive role. So I'm actually very happy to be part of that.
Yeah, so we've had people that come in before, and a lot of the reasons that they were brought here in the first place because of their mental health, whether situations have arisen in the community that just got them out of touch with the supportive care that they had before, or whether it be substance abuse, whatever it may be. Once they come here, this kind of gives them an opportunity to reset and get in contact with people that have helped them previously.
The whole goal is for them to get out, get hooked into the community, and hopefully not have to come back into jail.
I've seen a lot of patients that come in here, they just want help. So this is an opportunity for us to provide that help for them. And I tell them all the time, this is a horrible situation, but let's take it as an opportunity to get the resources that you may need.
So as you can see, mental health in our jail is a pretty big deal, and there's a lot of different ways that we work with our mental health people. Lieutenant Massey, what are your thoughts?
Well, you're absolutely right, Brian. Mental health is one of the most significant changes I've seen throughout the course of my almost 20-year career. And what we're finding is that we have got to ensure that we are being innovative and creative in the ways that we are providing care, in the services that we look for, and the wraparound care to ensure that people who are in custody and have significant mental health issues are getting their needs met.
Absolutely. There's really no one-size-fits-all, I think, approach that you can take, especially when people are dealing with a mental health issue. Deputy Toney, not only are we dealing with mental health, but that kind of also crosses over to substance abuse and a lot of other issues that we see in the jail.
Yeah, absolutely. A lot of times, like you're saying, there is a huge crossover. A lot of the folks that have addiction issues and they're coming in, if they are, on whatever drug or substance of choice that they may be struggling with, you'll see that happen all the time. But the fortunate thing is that we have medical staff on hand that's able to help them through their detox protocols that they'll put in place, so that people are safe medically. And then once they've kind of gone through their detox protocols with our medical staff, then we can get them in touch with mental health professionals that are working here in the jail every day too, so that we can get them plugged in there, so that when they do get out of custody, they kind of already have a plan in place so they can go forth and hopefully be successful the next go around.
Great. All right. Well, Deputy Toney, Lieutenant Massey, thanks for being with us here on our second episode of the WCSO News Video Podcast. And good luck and stay safe out there.
Thank you so much.
We want to leave you with one video here. This is kind of a year ago, a little bit of fun memory that we have from 1 year ago this month. Enjoy.
911, police, fire, or medical?
Police.
And what is going on?
I think there's an intruder in one of the bathrooms, but the bathroom door is locked. We see a shadow moving around, and the door is closed.
How many people inside the house?
There are 2 people inside, plus the intruder.
Incident number 797, burglary in progress. They knocked on the door, nobody's responding, but they hear noises coming from inside the bathroom.
5336, can we start a dog this way? We're hearing some sort of noises in the back of the house.
Last chance, Beaverton Police, searching the building with the canine. Come out now or you're going to get bit.
They believe someone's inside the bathroom. The bathroom door is locked and they can see a shadow under the door.
We're entering right now. We are all inside now.
Yes.
5266, we can clear the signal too. It is a robot vacuum cleaner.
I copy, it's a robot.
Clear. There's a bad guy.